Hello guys, this is Dr. Palaniappan Manickam. In this video, we have a very, very special guest, Dr. Ajitha Porkodi. She is a integrated medicine specialist. She is an allopathy doctor. She was my senior in my in PhD Medical College in Coimbatore. And she is also practicing Siddha medicine. It's a combination of both that you will never get. At least I have not seen somebody in person. So I thought we should definitely bring her in and then see how we can integrate both the aspects of medicine, talk about some controversies as well. And then I'm so looking forward to this interview. Let's welcome Dr. Ajitha Porkodi. Hello, Ka.
Gopal, how are you?
Good. So, I used to say Akka because she's my senior in my college, but she might not look like Akka. She looks like an...
Come on.
As I was saying before, Akka, I've never seen somebody who have practiced allopathic medicine, who've taught allopathic medicine, and also has a strong background of Siddha medicine in your family, and you're trying to integrate both together. And that is a wonderful thing that you are doing. Why don't you explain how you end up in this field?
Yes, thank you for the opportunity, Parni, because as you all know, the viewers, Dr. Palaniappan is doing an excellent job of educating the masses, because it's not an easy job, and he's having a great content, and it's absolutely for you people who are watching. It's for you. And first, I must congratulate Dr. Palani for that, and for the viewers who are like absolutely following his. And I see a lot of feedbacks from the comment session, and it's truly inspiring, because for me to come to this platform, I am feeling really grateful to the Almighty and to Dr. Palani for giving me an opportunity to do this. About a little bit about myself. The thing is, like, I think I must thank my tradition and my family for that, because we belong to a family called Moolige Mani in Tamil Nadu. I am the 5th generation of doctors in this lineage. And my forefathers were the royal physicians for the Arcad of Nawabs. Arcad Nawabs Kangalia. So for them, they were the royal physicians. And my grandfather, Dr. A.R. Kannapar, he was the founder and founder of the magazine called Moolige Mani. So this Moolige Mani was a series of awareness article written in Dinamani, the daily newspaper. It was established, and for about 100 weeks, about 100 herbs for 100 weeks. It has been explained with a pictorial diagram, and all the uses of the herbs, how we can use it in day-to-day life, how those herbs can be used as food, how we can cook it. So all those things that was published in the year 1965. So that was done by my grandfather, Dr. A.R. Kannapar. And then subsequently, he published a dedicated magazine to propagate about Siddha medicine and the herbs used in Siddha medicine, and how people can use it in daily life and attain longevity and a disease-free survival. It's for that. So that was my grandfather. And my father was Moolige Mani Dr. K. Venkatesan. And basically he acquired, yes, very popular. Both my grandfather and father are stalwarts in Siddha medicine in Tamil Nadu. So there are many families, pre-independence, we did not have a structured course for Siddha medicine. But now you have, BS, MS degree to acquire the knowledge of Siddha. But
when did that happen, Ka? When did BSMS degree came in? Like around...
I would like to tell a few, facts and history about this. Absolutely. So if you see the integrative medicine, the concept is not new to us. It's absolutely not new to at least Tamil Nadu, because, Kilpauk Medical College, which is in Kilpauk.
Yes.
It was the whole area, the Kilpauk Medical College was donated by Panagal Raja, to the people of Tamil Nadu. And it was donated to the government to run an integrative medicine center.
Is that right?
Yes. So if you happen to see, just Google and go to KMC website. It is there in the website. The history right from 1925 up till date. So Panagal Raja has dedicated this to the people of Tamil Nadu through the government, and they have started something called as DCIM, a diploma in integrative medicine.
Okay.
Okay, integrative medicine. That's one thing. And LIM, licensee of integrative medicine. So, based on this degree, it was always 4.5 years of any one of the three native system which is native to India. For example, either it is Ayurveda, Siddha, or Unani. So, anybody who joins these degree will have a training in Ayurveda, Siddha, or Unani for 4.5 years. And then one more year will be just like the house internship that we do, house surgency that we do in allopathy. In that year, the candidate will be exposed to basic, allopathic medications and the concepts of allopathy as well. So this integrative medicine was very much there and practiced in 1940s. But what had happened subsequently, if you go through the timeline, around 1960s, it has slowly, because it was the post-independence era, and even before the pre-independence era, because of the widespread practice of allopathy, okay, because it was new, allopathy gave a faster relief, and it was supported by science. But still, the British government did not sideline the native system of medicine. We had something called as RIMP. They had structured the course even before BSM MS had come. The British government had something called as RIMP, Registered Indian Medical Practitioners. So all the people who traditionally followed and practiced the system of medicine, Siddha medicine, were allowed to take up exams, and they had to clear it. They have to, acquire the degree of RIMP to be eligible to practice Siddha medicine. This was before the advent of BSMS degree. But then subsequently, the government had taken up BSMS degree, and it is given by the Dr. MGR Medical University, which is the biggest university in India. So that's what it is. That's the, in a nutshell, that's the history about Siddha medicine.
So bottom line is, what I'm hearing from you is, the interaction of our traditional, Tamil Nadu or Indian-based herbal medicine was there, supposed to integrate with allopathy. That was the intention to start with.
Yes, definitely. But then, in 1960, if you see the timeline and the history that's available in the KMC, website, then it was abolished in the year 1960. And then in the year 1965, I may be a year or two, this way or that way, but I think in 1965, a dedicated Siddha, the college was then instituted in Palaniappan South, Palaniappan. The government had installed that after a very long protest from all the pro-Siddha physicians during that time. So my grandfather and father were one among those pioneers who fought for the the restoration and for the restoration of Siddha medicine. And the Palaniappan thing had branched out to Chennai, because Chennai being the capital of Tamil Nadu, if we don't have a Siddha college in Chennai, this Anna Arch, Anna Nagar, we have this Siddha college. And my sister is also is a Siddha doctor, and she was in the first batch of the college which was instituted here in Chennai.
Okay, I'm going to ask you a very blunt question. Okay, so for example, yesterday, a couple of months ago, my niece was applying for after 12th grade, right? So she applied for NEET exam, and then she calls me, and then she says that, Mama, I couldn't get into medicine. What do you think about Siddha?
Awesome.
Right? So that is what the mentality is, including me, right? When I graduated, 2000 was my batch. So I didn't know about Siddha. I didn't know about Ayurveda. All I knew about was, MBBS, general medicine, and then get practicing general medicine. So So what do you think? Why is there so unpopular opinion about Siddha? Why are they taking it as a second grade option?
Yeah, the first reason is that, as I told you, after this was, the integrative medicine was not, encouraged in the year 1960s.
Mm.
All the native system of medicines faced a very bad time
Mm.
during post-independence period, where because of the faster relief that allopathy gave, and people were also so fond of allopathy, and they used to fancy they take a jab and then they're fine with
Mm.
just one shot of injection. They were fine, the fever is gone, satusi potent, all that kind of fancy things allopathy had offered.
Mm.
Slowly then the popularity of the native systems was not well received
Right.
or not well propagated. That was
Mm.
one reason. And
Mm.
number two, if you see, Siddha medicine is native to our Tamil Nadu.
Mhm.
And going by the literatures, let's not go, the pre-literature era will not go.
Mm.
Going by literature, Tolkappiyam is one of the oldest, literature that's available in Tamil.
Yes.
So Siddha has been mentioned as a part of, Tamil medicine. Okay,
Mm.
it's called Tamil Maruthuvam in
Mm.
Tolkappiyam. And there's
Mm.
lots of references and, about Siddhas, talking about Siddha. Siddhas are the people, 18 Siddhas, 18 number of
Mm.
Siddhas.
Correct.
So,
Correct.
in a nutshell, if you ask me who are Siddhas, they are nothing but huge superhumans.
Mm. Mm.
Siddhas are superhumans who, through their, their intelligence and
Mm.
their, they practice a kind of, possibly I can call them yogis,
Yogis, right?
rishis, right?
Mm.
So
Mm.
all these things. So these are all documented in the literature, Tamil literature called Tolkappiyam,
Mm.
and Siddha dates way back from 5th century. So it's
Fifth.
one of the oldest medicine which the world has seen,
Is it
and
is
it's
it from Tamil Nadu or
medicine.
is it from
It
Tamil
is
Nadu?
in Tamil Nadu. It originated in Tamil Nadu.
Nadu.
Okay, and it is on par with the Chinese medicine. But unfortunately, as you mentioned, the popularity is not that much
That much. Mm.
because there are a few other political dynamics to it.
Mm. Mm. But,
Okay,
but but majority, I think one reasonable argument is that hey, we need evidence-based medicine. So
yes.
for allopathy, we have this research trials. Okay, you do this, this is what is happening. So we have proven it. But Siddha unfortunately doesn't have that much amount because pharmacy you need funding. You need to pour money into these research
Yes.
trials. I
Yes.
don't you agree?
Yeah, definitely. Possibly, I would have agreed with you 100% if you had asked me 2 years ago. But from
Mm.
2020, I see a lot of research going into,
Is that right? Okay.
Siddha
Mm.
and, herbs used in Siddha,
Nice.
not in our country.
Mm.
Of course, our country, a few North Indian universities do, but I see, the popularity is more after government has, the current central government, after instituting the Ayush ministry. I feel
Mm.
there's a lot of research which is going on in the last 2-3 years.
Absolutely. It's
So the
exactly similar to how yoga is being adopted here in the Western culture now. And
yes.
if we go to an grocery store over here, they are selling these turmeric tablets. The turmeric. And my patient is telling me that you should take it.
Take it. I'll tell you. See, if you see, no, Pal, how long are you in
It's
US?
been 10 years. It's been 10 years.
10 years.
It's been 10
Now,
years.
I just wanted to ask you a blunt question. Okay,
Sure.
it's a essay question.
Absolutely.
So, okay, so I just wanted to ask you. So, what is the trend that you saw 10 years when you had started to practice? The trend that you saw in US, the kind of lifestyle diseases that you saw in US, the kind of patients that you got, and
Mm.
the kind of patients that you get now. So,
Well,
could you please just tell? Yeah.
absolutely. The drastic difference in the last 5 years, there is an approach called holistic medicine, integrated. So people who come to me for like peptic ulcer disease, I'll tell you an example. So I give him like omeprazole, pantoprazole as acid blocking agent, but they also have an integrated doctor, and they
Mhm.
use all the other, including Siddha, Ayurveda. I think Ayurveda is more popular here, at least
Mhm.
based on my experience. So So what they do is they give me this set of medications, and then they're saying that, okay, you are one of the doctors or one of the approaches and not the only approach.
Correct.
And I personally feel that is how it should be.
Definitely. See, point well made, Parni, because see, as a doctor, what we are dedicated for, we have to give the best solution for our patients' problems.
Right.
So it's not mine. So I believe no one system can completely address the different problems a single patient has.
Absolutely.
So my system might help the particular patient with their problem for say 60%, but still I am not treating 40% of the patient's complaint. So if I can complement it with another system, okay, I should develop the kind of a habit, that attitude is there. So the integrative medicine is not something that you're going to, read. It's something that you're going to, the skills has to be acquired over a period of time.
Right.
Because to integrate different big systems is going to be very difficult. And so if you get the idea of integrating the system and practicing it as an approach, that's where you're going to make a big difference in your patient's, treatment.
Absolutely.
Okay.
I personally vouch for it because I had one patient, right? So he asked me, what do you think about this integrative medicine? I said, Siddha medicine is where I was born. It's from the state where I was born. So, I'm so glad that Western countries are adopting this as one of the approaches. So I said that, allopathy is great in its own terms as well. So, when you have a problem, it will treat you right away. But I think you should think beyond that and then find an approach where you don't get a problem to start with. So I think that is where the preventive medicine comes through, and that is where Siddha has a role. What do you agree, or where do you think we should place Siddha and allopathic treatment in the patient's course?
10, 15 years ago, what the US was facing in their health, if you see in a bird's eye view, the kind of problems that the US was facing is faced by India now. If you see all kind of lifestyle-oriented diseases like diabetes, hypertension, obesity, and cancer is on the rise in India now. So what the US faced 15 years ago, we are facing. In that, I would appreciate all the scientists and doctors in America who find they want to make medicine cost-effective, clinically effective, and to keep the side effects minimum. So with that intention, they are vouching the concept of integrative medicine has become more widespread in the last few years, at least 3-4 years in the Western world. So in that attempt, as you said, yoga is now instituted in most of the universities in US. They are incorporated as a part of lifestyle modification and it's advocated to the patients. And on that note, I would like to say, in the University of Texas, MD Anderson's Cancer Center, USA, Dr. Lorenzo Cohen, he's a professor and he's into cancer prevention and lifestyle modification, and he is practicing yoga for the last 20 years and he is advocating it for his patients, and he has as you said, there is no randomized clinical trial. He is putting it on papers now. He is putting it on scientific papers now. I kindly request all the allopathy doctors and even Siddha doctors who are watching this video right now, you should develop this kind of awareness, this kind of approach, okay? Because this integration only the allopathy and the Siddha doctors can do. No one else can do. As I told you, one patient will have multiple problems and there are different facets for the problem. There is a famous English proverb called one man's food is another man's poison. So if food itself is a poison, one man's food is another man's poison, then what about medicine? Right. So it is custom made, and this concept of personalized medicine is also evolving in the Western world.
Yes.
So a 500 milligram of paracetamol will relieve your headache. Okay. That there's no other medicine which is as good as a paracetamol for your headache. Okay, if I have a headache, I just wanted to get rid of it in the next 15-20 minutes. Okay, use allopathy for that. Anything acute, any emergencies, allopathy is the best. But when it comes to lifestyle-oriented diseases, prevention of diseases. Okay, and treatment, you can definitely, you can take a combination of both the systems. Okay, and Siddha medications are all in the form of tablets and powders, syrups and extracts. It's all available and it's all easy. So what I usually advocate in my practice is, for all acute and emergencies, seek allopathy. Okay, you want your blood sugar to come down, you want your HbA1c to come down, take all the latest things that is available in allopathy. But at the same time, when you're in a safer zone, you can start with all the complementary medicine, so that you have a very stable, way of handling your problem, your diabetes or hypertension, whatever it is. And so all the chronic complications due to chronicity, if diabetes or hypertension has to give you some problem, that can be tackled very well with Siddha medicines. So all your arteriosclerosis, atherosclerosis,
right, the blood clots,
elevated, lipid parameters, all those can be beautifully reduced with just plant-based medicines.
Okay.
We do have evidence for all those things.
So, the other concern is that, when people talk about Siddha, is that, okay, what are the side effects of this? We don't know what it will bother us or not. What is your take on that?
Okay, see, there are a few things I would want to highlight it now. See, Siddha is very much a structured degree, and we do have, registered medical practitioners who are trained in Siddha now and qualified as BSMS doctors. I would request the audience to go to a trained, degree holders, certified doctors, Siddha doctors, to get yourself treated, because there is a famous proverb called as alavukku meerinal amudamum nanju. So amudame nanjaidum neenga alavukku adhigama saaptingena, appo வந்து மருந்துகள் சாப்பிடும்போது இன்னும் எவ்வளவு கவனமா இருக்கணும். Quackery is there all over the world, all over the systems. In every system there is quackery, because it's, because it is plant-based medicines, and it's also readily available, okay, in the form of greens and herbs. So, and to a certain extent, government also should take a strict and stringent actions against the quackery, the quacks. So, but then this is not the problem of the system, it's the problem of the regulating system. The government should take strict actions against people who are not trained and qualified. But for the viewers, I am telling you, please make sure that you go to a very well-known, at least not well-known, a qualified Siddha doctor, because every drug, okay, be it in allopathy or Siddha, there is a way to eat, there is an amount of dosage that you should take, just not a blind treatment that we give. Side effects are there throughout, all the system. Even in allopathy, if you take painkillers, tedious, thrice daily, okay, 3 times daily for 15 days, I'm sure your kidneys will be knocked off. So, there's no better knocking technology, other than just popping up few NSAIDs. I frequently see this in patients with arthritis. They do not know, and because you get NSAIDs over the counter, and in our country, the pharmacist can easily prescribe NSAIDs.
Just for the audience, I think what she's talking about is a knee pain. When you have pain or something, you take like Brufen, naproxen, those kind of painkillers. They do have side effects. They can damage kidneys. But the argument to that is, we know that it is causing kidney disease in allopathy. So we at least caution patients that, if you have kidney disease, don't take it. But do we have that much amount of data in Siddha, and how do you argue that?
Yes, we do have, and there are a lot of trials which are going on with the Siddha medications, and everything, till we get those evidence-based medicines, proven from an allopathy point of view. You want evidence-based medicines, you want trials. No, that's what is the whole point. I'm trying to make a point to the allopathy doctors as well. Just integrate. There's so much. Don't expect for the endorsement from the Western world. People have started in Western world. They've started all the research across our system. But I would say, I'm sure, as you said, Ayurveda is more popular there, and I'm sure Siddha researchers are also going world over, as I know, through my contacts. Okay, so what I would say,
I'll tell you something. I'm sorry to interrupt. After we do like 3 years of residency here, MD General Medicine. Okay, so MBBS 5 years, MD General Medicine 3 years, and after 3 years there is a 1-year fellowship of integrated holistic medicine now. And
Wow.
people can do that, and people are doing it because it's a concierge medicine. It doesn't come under the private insurance policies over here. You pay out of cash. In US, medicine is so expensive that
Yeah.
these guys are willing to pay like $300 for a single visit out of cash, out of pocket. So that is getting more popularity these days. So coming back
That's
to
the
your point,
future, Dr. Paini. That's the future.
that's the future. So you're
That's
saying
the
we should
future.
charge $300?
No, I wish it can be brought under your insurance.
Yeah.
So that's what I'm telling. So the thing is, if our Western scientists and doctors could find out and do research on complementary system, our own, we claim that this is our own system. So I request the government also, the government officials, if someone is seeing now, I would request kindly integrate the system.
Right.
The tradition is very much good. The traditional medicine has evidences in the form of literature. I'm really saying just add science to it. Make it more randomized, bring them under the randomized trial, make it more safer to use. We know, as a person who's practicing integrative medicine for the last 16 years, I am telling most of the patients, almost 99% of patients have only gained maximum out of integrating the systems.
Right. So
and
from allopathy, I can speak from allopathy standpoint that, to be honest, we don't have that much amount of medications or intervention that we can do for a disease to be prevented. We have a lots of options once the disease comes in. So, the medicine that we have generated in Tamil Nadu has to be popularized throughout the world.
Every system has its own merits and demerits. So if you ask what are the merits of allopathy, I would say a quick relief. Okay. The surgical part of the allopathy is excellent. We do have robotic surgeries now. Lot of doctors are excelling in robotic surgeries. Okay. And we have microsurgeries. What not?
Right.
So these are the merits of allopathy. But allopathy do have some pitfalls where Siddha medicine, heals. So kind of, as you said, preventive medicine, we don't have medicines to prevent, but I can name at least 5 to 10 number of herbs that have, a very good effect in treating the chronic complications due to diabetes or hypertension. Herbs and raw drugs that can be used to reduce weight and to tackle the obesity. Raw drugs that can be used to reduce or moderate your, high cholesterol level, undesirable lipid profile that can be altered by raw drugs used in Siddha.
You're talking my words now.
Yes. Borrowing it from you.
No. Like obesity, cholesterol levels, you're coming into my channel.
The only thing that we need is we need to put them on the scientific paper. We have to release it, get it peer viewed, right? So that is what we are lacking. But if you see, it is very evident. It is clinically effective.
So in your practice, you have seen people lose weight, control your cholesterol panels using these medications.
Yes. If you see, food as medicine is becoming another recent concept in the Western world. But it's not new to us. It is there in our culture, in Tamil culture. And fasting, intermittent fasting, Pati, Dr. Parni has spoken n number of videos. And I would say Dr. Parni is adding so much science to what we have been practicing and what our forefathers have been practicing. So we used to have all sorts of fasting, you name it. Ekadasi Viradam, Ekadasi fasting. And some people, my tata keeps saying, that means I will eat only one time.
One time.
And how this concept evolved and was followed through many generations from the fifth century is that through hearsay and through proverbs. There are so many proverbs that if you see, Tamil medicine, Siddha medicine has another name called as grandma medicine, because the grandma keeps saying so many problems. Party Vaidyam. She keeps saying so many things for the generation to come. So party, if you ask me,
Party is equal to randomized control trials actually, because based on the experience.
Based medicine. I think probably she was the science direct and
Right,
Elsie was those days. Okay, but then party will also tell you how much to have. She has the quantity, how much you should not exceed that quantity. If it is just a half amla size, it's only half amla size and nothing more. It's like that. So, for example, if you see, intermittent fasting has been practiced in our tradition and culture. All sorts of viradam, Ammavasya viradam, Paurnami people do fast, Ekadarsi viradam, and Sashti viradam. Every year after the Vinayaka Chaturthi, around that time, September, October, we follow Sashti viradam for 7 days.
Yes.
You just have only water, and I'm sure, like other than Tamil, also Jain communities.
Many
Yes.
religions. Here in Jewish have their own kind of fasting. So they think that the more they fast, the God will give them more prosperity. But actually, it's the other way around. The more they fast, their body itself will give them prosperity.
I think prosperity means the longevity. With mobility. That's what they mean as prosperity. In terms of having a very quality life with a longevity is what we are all striving for. You can take a wish and live for 100 years, but what if you're confined to the bed for 40 years? We don't want that kind of a living, right? So that is it. So if you see, there are few proverbs that I want to highlight. So to the Tamil audience, if you see, the Siddhas used to say, there is a Siddha verse called as, it goes by this way, Orupodu unban yogi, Irupodu unban bogi, and Muppodu unban rogi. So one time, the yogis eat one time. The bogies are the rich and the lovers of life. They eat 2 meals a day, and people who eat thrice a day will become the diseased.
The rich means rich in healthy people.
Rich and healthy, yeah, that's right. And if you see, as you say, most of the videos you keep insisting on having your food by the sunrise and by sunset.
Yes.
So have we not heard this from our grandparents? Because those days when the electricity was not used this much, abused to this much, we stay awake till 12 o'clock, 1 o'clock because we have lights. But those days, I remember my grandfather, he won't have food after 6 o'clock. And that's the time that you say that the insulin peaks. It starts to peak around 12 o'clock. It starts to peak. It starts around 8 o'clock and peaks at 12 o'clock and comes down at 6 o'clock.
Nice at 6 o'clock, yeah.
Yes. So this is the pattern that we had followed in our religion. People don't eat after 6 o'clock, after the sunset. But now, because in the last 20-25 years, because of westernization and modernization, globalization, call it anything, people have forgotten the roots. People have forgotten traditional way of eating and sleeping, the lifestyle.
So you were saying that this has been practiced in Siddha medicine as well. Is that what you're saying?
Very much. And you had asked for an example to reduce weight and obesity. So horse gram, what we call as kollu. Again, I bring the granny in the picture. Now kollu yelachavanukku yellu. Kollu rasam we have. I remember my party and my mother also makes kollu rasam. So for people who are obese, horse gram poi Google panni parunga. You can see umpteen number of it's one of the superfood which the Westerners call now. Westerners have taken horse gram. They have seen what is the the use of it. They have evidences. They have documented it scientifically, and now they have established it as a superfood. And I can tell you, murangaka. Now it's called moringa because it's coming from, the evidence is coming from there. Moringa has become a superfood now. It's in vitamin A and umpteen number of good in iron. So it is very good. It alleviates arthritis, all sorts of arthritis, even rheumatoid arthritis. And it is supposed to be an antioxidant, anti-inflammatory, and it is supposed to eradicate free radicals from your body.
Wow.
So there are so many superfoods. So this.
So you're saying that the moringa thing is coming from Western now, Western medicine. They're saying that
Yes,
use this more.
moringa is now being declared as a superfood by FDA.
FDA. அது நமக்கு தான் முன்னாடி தெரியுமே.
நம்ம வீட்டு வாசல்ல இருக்கும் முருங்கக்கா அத நம்ம வந்து மதிக்கவே இல்ல. We don't adore our grannies. We have forgotten her proverbs. So all these things I would like to bring it into light. So another thing, if you ask for
so answer your question. Horse gram na vande so in your practice, so how do you do that? So you give horse gram to the patient? How do you?
No. So horse gram, I don't give it or give it in any form. I will just ask them to use it in the way it is used traditionally. I will give them a diet modification which will help them. So what you eat will make you, right? So their food will be altered. That's what the counseling is for. I will give them a complete counseling, what should go in and what should not go into their mouth. That way I tell them. So horse gram can be used as it has to be soaked for some time, and it is not it cannot be cooked very easily. So as a form of rasam, it can be kept. That's the traditional way of taking horse gram. But I guess in America you get horse gram tablets and all those things, right?
Anything that you tell in Tamil Nadu, they have wrapped up in capsules.
I know.
$10 per piece.
So that's another thing. And one more thing I would want to say, which now after turmeric, yoga, moringa, and all the horse gram, now more and more evidences we are getting it from the Western world, which I would want to highlight it to our people.